Okay, we're going to do an ultrasound of the shoulder. We're using our linear probe. Just going to apply some non-sterile gel to the area. We're going to have some views of the main structures of the shoulder. So looking here at your ultrasound probe, you've got that little notch there that's going to correspond on the screen to the left side. And generally speaking, I like to have that oriented with the anatomy of the patient. I'm going to hold my probe like this and have my thumb and my middle and index finger on the probe, and then my fourth and fifth digit can kind of just rest on the patient to kind of secure that. We can look at the anatomy here and make some adjustments to the depth of our image. In this particular view, we're just at the top of the shoulder. I'm coming back. We can see at the very bottom of the screen there's a darker area here with the line, which is going to be the spine of the scapula. Then anterior to that is going to be that large muscle underneath, which is going to be our supraspinatus, and then that's here, and then just above that you will have your trapezius, and above there our subcutaneous tissue. I've just changed the depth again. As I'm scanning here, I'm looking at that bottom bright white line and watching as it dives down a bit, and we can start seeing where the scapular notch is, where the suprascapular nerve will run through there. It could be a target for an injection, such as a suprascapular nerve block. In this approach, you might have the probe here, either on long or short axes, bring the needle across so that it comes and deposits as a combination of your injectate in this region where the notch is. Now, if you really want to know that as far as ideal placement of the injectate, it should be underneath that transverse ligament overlying the arch. You put color on, we can sometimes see around that region some of the blood vessels in the area as well. Coming back posteriorly, this is the area that you can access the posterior entrance into the glenohumeral joint. So the black is going to show up here, indicative of bone. We're going to look for the junction between the humerus and your glenoid fossa. So here we have the contour of the humerus, we have the glenoid, and in between there's like a V-like shape with some hyperdensity or a brighter signal. I can go a little deeper on the depth. And that can tell us that that's the joint that you would access right there. Placing a needle in there would get you into the shoulder joint proper, the glenohumeral joint. The hyperdensity area might be indicative of the surrounding labrum. So the downside of a posterior approach to the shoulder is that you could be placing the needle through the labrum and causing a slight injury to it. Clinically, that is questionable as to the impact, but it's good to know that's one entranceway.